Very good morning to all of you, the participants, on the occasion of World AIDS Day. And I congratulate everyone from the Center for Distance and Online Education, Tezpur Central University, on this occasion. Now, considering the possibility of a community's most enabling and supportive role in eradicating AIDS, World Health Organization has this time appropriately kept the theme "Let Communities Lead" for the year 2023's World AIDS Day. Now, on this occasion, Center for Distance and Online Education, Tezpur Central University is privileged to have with us a very young achiever, Dr. Jongshina Jamir, an expert in community medicine. Let me quickly introduce her to this because in the very young age she has achieved a lot. She is currently pursuing her MD in Madras Medical College. During her MBBS itself, she was acknowledged with a certificate of honor for her achievement in community medicine. She is an external monitor in intensified mission Indradhanush 4.0 immunization campaign of WHO India. And Dr. Jamir is also member of Indian Association of Preventive and Social Medicines. So we acknowledge her achievements and we welcome her to the Center for Distance and Online Education, Tezpur University, on the occasion of World AIDS Day. I request Dr. Jamil to deliver her speech. Thank you.
A very good morning to each and every one of you. I hope I'm audible.
Yes, you are very much audible.
Thank you so much. So first of all, I'm very thankful for this opportunity that you've given to me. And like you all can see and are aware that I'm still in the starting phase of my career when it comes to community medicine. So I'm very thankful for this opportunity that you have all given to me. So I'll just start my presentation. I'll just share it and you can let me know if it is seen for all of you. Is it audio? Is it?
Yes, we can see this.
Okay. Yes.
Actually, the weather in Chennai is not good nowadays, so my network is a bit glitching. I apologize for that. So is this clear for everybody, and am I audible enough?
Yeah.
Yes.
Okay, so I'll just begin.
Yes, ma'am.
Today we'll be looking about community aid in AIDS dissemination, and this is, as we are all aware, WHO's theme for this year's World AIDS Day, that is "Let Communities Lead." So since we are having a very short time of 1 hour, AIDS is a very, very big topic to cover. And when it comes to just talking about even communities when it comes to AIDS, it's a very, very vast topic and we can go talking about it for hours. But since it is a very short time that we have, I'll be talking on these few points that I have done. So first we'll look at the introduction, then we'll look at understanding the current landscape about how AIDS is prevalent globally as well as in our country, the role of community aid, and overcoming the barriers to community involvement, empowering the vulnerable population, challenges and opportunities in the future, and the conclusion, which I will be ending my presentation on. So before we go into what the community can do when it comes to AIDS, I would just like to refresh up from a medical point of view as to what AIDS is and how it comes into it. And don't worry, I won't be going too much into the jargon of it, just a very simple introduction to it. So, as we all can see over here, this is how a virus looks like. And AIDS is a viral infection. It is the abbreviation of acquired immunodeficiency syndrome, meaning it is not just one disease. Syndrome means it is a collection of many, many diseases together, like symptoms together. That's why it's called a syndrome. And it is a fatal disease that is caused by this virus known as human immunodeficiency virus. So, what happens when this virus affects anybody or a person is when the immune system of anybody is being broken down, and because of which the person is vulnerable to many life threatening opportunistic infections. We call it opportunistic because if the person's immune system was okay, then we will be able to tackle it. But when it comes to AIDS, that normal tackling, the normal army cells, as I must say, the T cells are lesser in number. So because of which this person is very, very prone to infections, which can fatally even lead to death. So when we say AIDS, AIDS is not just the beginning of the disease. AIDS is actually the final stage of this infection that is caused by your human immunodeficiency virus. So we'll just quickly look into the three stages that happens actually when it comes to an HIV infection. We will actually start only with the acute HIV infection. So in the beginning, everybody thinks that okay, they'll just have fever, headache, sore throat, like the normal things when we all have a common flu. So this is in the acute phase. This is how the disease begins. After that, we have the chronic phase. This will follow after the acute phase, and here the intensity will be a bit more depending from people to people. The same symptoms might progress, or in some people there are also cases where there's no symptoms at all, they'll be completely fine. And because of this particular lag phase, latent phase that is there in this infection caused by HIV, many people come off only in the last stage, that is your AIDS. AIDS is the final stage of this infection, and in here they will have all the in fact the causes symptoms of infection that are very, very high and up. Then people will think like, okay, maybe it's time to go and get myself checked, and this is when people come to realize that they have AIDS. So AIDS is actually the end point of an infection that is caused by HIV. So this is a little bit of introduction on what AIDS is, how it is being contracted, and how it is being presented, and why is there a lag in the diagnosis of AIDS. So I hope that is clear for everybody. Okay, so as we can see in the slide, and I just, as I said, so AIDS is like the final stage of infection when it comes to HIV virus. So next slide, please. If you look at the current scenario of how it is globally and how is it in the country of India, uh, so globally, if we see currently the people living with HIV, that globally it estimates, and this is like the updated one that was updated in July 2023, there are globally 39 million. And when we compare it to the 2010 data, that this is an increase by 24%. So people living with HIV, meaning the infection is spreading, the spread is still there. So what can be done into it is the question that we all have at the moment. And but if we look at the other two estimates, that is new cases of HIV, and if we look at HIV related deaths, it's interesting to see here that there is a 38% decrease in new cases, and there is a relatively 51% decrease when it comes to HIV related deaths, meaning the people who already get themselves diagnosed and they follow the treatment on time, if they do so, then HIV is something that can definitely be controlled. And we can see that for the people who are living with HIV, even for them their living is also much more better, increasing their chances of living, seeing that the deaths have comparatively reduced from the previous data. If we look at our Indian scenario, India currently over here, we see that India has around, this is all together when it comes to all the states. Since you are all in Assam, I've taken for Assam per se. Assam, if we look in lakhs, the people living with HIV is 0.25 lakhs in Assam only. And if we look at all over India, there are currently 24 lakh people all over India who are living with HIV. Next slide, please. So, what's India doing right now? is, yeah, next slide. What's India doing right now is that we are following a particular target based approach when it comes to dealing with HIV. And this particular target based approach was started in the year 2014 by UNAI AIDS. And we follow this 95, 95, 95 approach when it comes to HIV. So the first 95, it stands for people who are living with HIV and who know their HIV status. It is not the whole population, only the ones who are with HIV and who know their status. That's the first 95. Second 95, we look upon the people who know their status and they're also currently on treatment. And the last 95 is the people who are on treatment and then their viral load, that is the amount of virus that is there in their body, that is in suppression. So we are trying to reach a goal of 95% in all these three aspects. So currently, as we can see in the country, when it comes to people who know their status, it's only at 77%. And that is comparatively better than the previous years, but still we still have a long way to go to 95. And for the ones who know their status and they're on treatment, it is at 84. And then those who are virally suppressed, it is constant at 85. So meaning, again, people, if they get to the treatment on time, this disease is definitely combatable. I'll just quickly share about how Assam is doing per se when it comes comparing it with India's average. So India in the first 95, that is those who are having HIV and they're aware of their status. India is at 77, while Assam is at 52%. So there are still many people who are still not aware. So awareness will play a very big role. This is where our community is going to play a very big role to bridge this gap. Secondly, the next 95, that is the people who are aware and they are currently on treatment. That India is at 84%. But when we look at Assam is again, it is at 72% only. Still a big gap is present in there also. And that can be because of many reasons. There can be reasons like they're unable to reach their particular health facility, they're unable to afford, or they're not aware of these things, or they are not sticking to their treatment. It can be anything. So that is the second 95. And the last 95, that is those who are having HIV and those who are virally suppressed, meaning their viral load is definitely in control right now. It's very, very interesting and very good to see here in this case, next slide please, that India here has an average of 85. In this, Assam is at 89%. So we can see that people, once they go and once if they are able to if the from the medical side or even from the community side, if a pressure is given for them to have their medicines to be properly on treatment, we can see that we can definitely manage the viral load, which will again help in the spread of the disease. It will help in reducing the spread of the disease. And it's very nice to see here that Assam is getting closer to 95 and better than the average of our country. So this is a little bit of a summary on how the country is doing, how globally AIDS is at the moment. And now we will go on to our topic proper, that is the role of community aid. So why community aid? Community aid will create a comprehensive and a very effective response to HIV/AIDS, because AIDS is a disease that is not only something that is dealt with medical side as only, but then it has many other aspects: the social aspect, economic aspect, cultural aspect as well. So when a community comes and helps in this disease, all the other aspects that play an even more major role, it will help with combating this disease. And lastly, it also will be able to reach one of our sustainable goals, that is the sustainable goal number 16, to promote peaceful and inclusive societies. Other than this, there are also many other points in which community aid can help in AIDS, that is, we can improve health outcomes, we can mobilize the demand for services. If community goes in, if the community is very active, definitely they will be able to mobilize the services for the people who are affected. The people will be more aware of the services that are being provided, so in turn it will definitely help in bringing down the numbers that we just saw, and reach the people with services that are difficult to reach with formal health systems. Definitely there are many hard to reach areas, and there are many people in hard to reach areas who are suffering from AIDS. So for them also, it can definitely make a big role. Support health system strengthening, change the social attitude and norms, which is a very big thing when it comes to AIDS, and also create an enabling environment that promotes equal access. Enabling the environment is one thing that I believe as a community we need to really work on, because it means to be inclusive of everybody, inclusive of each and every one of the vulnerable population that we are all aware who are usually prone to the disease, and also be inclusive of the people who are currently living with HIV in our communities. So we'll just go quickly one by one as to what can be done. We just saw all the things, that good things and very important things that can come out of community aid. So what can be done in order to even start a little bit of the good things that we just saw? The first thing, as we all are very aware, education and awareness. There was, I think, in the glitch of my slide presentation, I even had a slide on HIV transmission. So HIV usually, that we have a very people usually are very confused with how HIV is being transmitted, right? So HIV is being transmitted. It will be there in the beginning of the slide. So HIV is usually transmitted by blood transfusions, if there is any unprotected sexual encounters, multiple partners, and if there is any unsterile usage of instruments, like be it in surgery or be it in these injectable drug users, if it is there, then those causes HIV. In organ transplantation, in blood donation, when there is, and from mother to child, a vertical transmission during breastfeeding, there is only these kind of things, a direct, when there is uh, uh, a direct contact with these fluids, that too from fluid to fluid, that is when HIV occurs. HIV doesn't occur by just eating together with the person who is with HIV. It doesn't occur by sharing the same restrooms. It doesn't occur by just holding their hands, or it doesn't even occur by insects, like example like dengue and malaria, which happens by insects. The vector is insects in that case. But in the case of HIV also, it doesn't happen. So educating and making the people aware of this particular how HIV transmits can make a very important role in just even dealing with a little bit of HIV. And for that, one can conduct educational programs, distribute the information materials, organize workshops. People do like different things, like having marathons, that again for awareness, going to different schools, having essay competitions, having different type of speech competitions, etc., so that people are aware of this disease and also how it is being communicated. We can use that as a platform to talk more on this disease. Secondly, after education and awareness, we have stigma. So stigma is a very stigma reduction, right? When it comes to many diseases in India per se, there are many that have stigma, like tuberculosis still has stigma, leprosy still has stigma. The filariasis, where it's known as the swelling of legs, where it becomes very big, that also has stigma. But then the stigma that comes around with AIDS is a very big stigma. All these diseases have it, but when it comes to AIDS, it's still a very big major issue. So when community goes into it, there can definitely be a reduction in this stigma that is with HIV/AIDS. How can we do that? We can talk about, first very important thing when it comes to HIV stigma is that there are three important things. When what stigma do people have? One, the first thing is that only certain group of people can get it. That is one stigma. Only the ones who are in the vulnerable population can get it. That big stigma is there. But like I mentioned, the transmission can be due to blood transfusion also. It can be because of organ donation also. It can be through all these things. So it doesn't mean that only one particular group of people is going to get this disease. We have that stigma. Second stigma, it also affects the moral judgment of people when it comes to HIV. We just people tend to morally judge when we come to know that HIV is there. So that is another second important stigma. And the third stigma is when a person tries to help or tries to advocate about HIV, again stigma follows around that person as well. When they're trying to advocate for the disease itself, a stigma forms. So these are some of the stigmas that are prevailing when it comes to AIDS. And as we all know, after stigma will come our discrimination. So discrimination, previous slide itself, discrimination itself, it means that when we put all our stigmas into action, that is when it's going to be discrimination. So there are certain points in which this discrimination, it can be reduced, and that can start with us itself. What can we do? Actually, I had included the slide, but I think Ms. Akam has shared the one that I had previously shared with her. So I'll just read it out for you all. So I'll just mention 5 or 6 points in what we can do to reduce stigma. And that one very important thing is the way we talk, the way we address this disease. Instead of saying it as AIDS, AIDS is the entire syndrome. When we say someone has AIDS, it means that they are actually infected with the virus. It's the HIV. It's not, AIDS is, like I said, it is the endpoint. So when we say, instead of saying AIDS, we can change the way we phrase it. We can say HIV. That person is infected with HIV. The person is infected with HIV and AIDS if they have AIDS, so that the stigma around the word AIDS will go. And then we understand that this is a viral infection that is caused by a virus, right? So next one is, again, sometimes when we say like victims, right? We say victims, people who are sick, people who are contaminated, etc. The way we say that, we can say people who have HIV, people who are living with HIV. The way that we usually tell, we won't say a patient in a general setting. We can't say HIV/AIDS patient, because a patient is only when they're in the hospital. Once we all come out of the hospital, we all are not patients, right? So the way we address this in the community can again definitely be different. One very important thing when it again comes to delivery of what we say is, we say positive, right? HIV positive, positivers, HIvers, these words are still there. So in order to, instead of saying that they're positive or they say HIvers, we can say that they are infected with the virus, right? Because a person is not the disease, a person is not AIDS, a person is not HIV. It's just that the person got infected with the virus. So the way we deal with it, instead of saying they're positive or they're HIvers, we can say that that person is, we can encourage the community to say that person infected with HIV. And then one more thing is, last one that I would want to mention is, we usually say IUD, injectable drug users, right? We say that they are in the vulnerable group. Yes, but instead of that, we can refer to them as people who inject drugs, because it doesn't mean injectable drug user when we say, it's not about the person per se, but we're talking about the category, that this is the category of people that is using injectable drugs. So these are some small things in the way we talk itself, in the way we approach the disease itself, can help in reduction of stigma. And if we take these points to the community, it will definitely make a difference in how the disease is being viewed in the coming days. The next slide, we can have support groups. Yes, definitely. We can encourage the community to have support groups where the people who, in this, it's going to be two way. One way is the people who are living with HIV, they also get a place to come together to share their experiences. Secondly, if the community is also, in with the support groups, they will also get to know more about the disease. And then slowly from here itself, the stigma will get reduced around this disease as well. So support groups can definitely help a lot when it comes to the community aid and how the community can come together. Next slide, please. We have different prevention programs that is already ongoing in the medical fraternity, as well as the different programs that are there, that are in the government, like our national AIDS control program that is already there. So we have different outreach programs. What the community can do, volunteers, definitely community organization volunteers, they can go engage in outreach programs and promote safe practices, safe sexual practices, distribute condoms, encourage regular testing for HIV to all the people. So just saying this and going around into the community and spreading this message will definitely strike for one person. And if we can get hold of one person, that is definitely going to save many other as well in a disease like HIV. And we also can provide resources. as well to for harm reduction strategies. Like we can have needle exchange programs for people who inject drugs. That's just an example. And like here in the hospitals also, especially in government hospitals here in Tamil Nadu per se, condoms and all, they're just kept at the desk, at the registration desk for people to just take, so that people might be shy also to come and ask, example. So we should this stigma and all these things, community can help in that by talking about freely about all these things freely, about unsafe sexual practices, about sexual education, about condoms, etc. One of the most common ways of, what is one causing the most common way of transmitting this disease. If we talk about it freely, definitely that will make a big difference. And next, when it comes to how can the community help, is access to healthcare. How can we improve as a community access to healthcare? And I think that is by voice. If the community talks about that in their particular area or in their particular setting, they do not have our voices play a very big role in that. If we come out to it and talk, so we can give a voice to those people who are living with HIV or those vulnerable population. A community can become a voice for them so that their access to healthcare is better, and then they will be able to definitely improve their conditions with living with HIV. So this, how can the community help in that, is by involving themselves in advocating for policies that facilitate healthcare access, and also collaborating with healthcare providers to ensure quality care as well. And the next point that we have, next please. Yeah, next. Testing and counseling services. Testing and counseling services are there in all the government setups when it comes to healthcare per se, but maybe through community again, we can also give advocacies in order to offer free or low cost HIV testing, so that it is more accessible to each and everybody, and so that people are even more freely open to coming and testing for HIV, and so that it is easier for them to know of their status and also seek appropriate care. Like we saw in the beginning, the 95, 95, 95, we saw that many people are there and still not aware of their status. We were still very low in that. So if we maybe make a voice and then help as a community go together and try to offer these and be in collaboration with the healthcare workers and offer free and low cost HIV testing, then definitely this will help in achieving one of our targets that we have set, and which will in turn help the people as well. Next, please. Then youth engagement. Definitely, the youths are the building blocks of the country and the future generation of the country, and the voice of youths and the passion that the youths have, we can definitely make use of this when it comes to HIV and the further progress of this disease. So we can have target young people with educational programs which can aim to prevent new infections by in them promoting safe behavior and also providing accurate information about HIV/AIDS. They say small drops makes a river, right? A ripple makes a whole river. So if we start with one or two, start with the young generation, the entire later on the whole river that we have of the country or globally per se, it's going to make a very big difference. That is again one more big thing where community can come in and help in combating this disease. And the next one is capacity building. So one can build the capacity of individuals and communities to respond effectively when it comes to any HIV epidemic. So this can include, training the healthcare, be it healthcare professionals, be it educators, be it community leaders, be it volunteers. Training is very essential. So again, for this as well, we can all come together and seek these trainings and seek to capacity to build our capacity when it comes to this particular area. And the next one, please. Research and innovation. I think this is one area where every one of us can, just by even just sitting at home, and maybe if you don't want to go out to the field, we can do a lot of things when it comes to research and innovation, just by seeing reading different papers or coming together and participating in different studies from whichever part of whichever area you can help out in. This will help to promote the adoption of innovative approaches to prevent, treat, and as well as care for this disease. So, research and innovation, we are still very much, we have a lot of research already in AIDS, but if we again go more into it, I think it will definitely help more in the coming days as well. Um, After this role of community, I just included this one small paper of how there were successful models of community engagement. Since it's a very short talk, I didn't include more of the papers, but if you want from my slide, you can read it from the references as well. So this was a study that was done in Nigeria, and they did a community-based organizations and the availability and the utilization of the HIV and AIDS related services that was done in Nigeria. And this paper also, if we keep reading it, we see that the community played a very big role when it came to the utilization of the HIV and AIDS related services. So this shows that definitely community brings a very big change to combating this disease. Next, please. So, coming to our next thing, overcoming barriers to community involvement. Definitely, we talk about so much of involving the community, but it is easier said than done. So what are some of the barriers that we have? First and very foremost thing, stigma and discrimination. Even though we say that we want to go up against and like talk about HIV and help the people with HIV, we ourselves, stigma is a belief, right? And discrimination is what we do it when it comes into action is going to be discrimination. Somehow each and every one of us, unknowingly, subconsciously, we all have stigma inside. There's this belief that this is wrong. So it can start with each and every one of us when it comes to AIDS. And so that slowly, if we are able to do it, we can engage other people as well to deal with stigma and discrimination and go more closer to combating this. Cultural taboos and norms. Culturally, there are so many things that makes us not want to associate it with this disease. As we all know, like the most common vulnerable population, I must say, are the transgender sex workers, men having sex with men, and the inject people who use injectable drugs. So if we as a community, let's say us, if we want to go and help the people with AIDS, this is the population that we're going to be dealing with, the four population that I just said. So once we go and start dealing with them, definitely the cultural taboos and norms will fall upon us. Example, that's just a thing. So in order to push the community to go and talk about this is a very big barrier that is there when it comes to involving a community with this. So how do we get rid of this? How do we overcome this barrier? Maybe for people who are having, like, for example, the major community that is sex workers, we can help to we can include them in our general community as well, and also acknowledge their work, that what they're working, listen to their vulnerabilities, what they have, be inclusive of all these people. Maybe that can help us to break the taboos and the norms that are there. And limited access to healthcare services. Most of the Northeast regions definitely have a lot of limited access because of the hard to reach areas, because of the terrain that we are in. So the community can come together in this, I think, per se. Like, definitely medical field also works in this, but if the community comes together to this, to go to a particular to those people who are living in hard to reach areas, you don't necessarily have to have a medical degree in order to just extend or be a voice for them. So how do we help? There definitely, in our national in our medical mission itself, we have ashas, we have women health volunteers, all these volunteers who help. So we can encourage the community to be a part of this, so they also get to work and also help in eradicating of this disease and overcoming this barrier. Gender inequality, very important thing. Why do I say gender inequality? Is that people, when it comes to male and female having HIV infection, when it comes to the female, people just generally tend to look down on the female compared to the male. When it comes to the male, according to different studies that were being shown, if they do not engage or if they stay apart from the others, then it comes as they are being, singled out. They want to stand by themselves. But when a female it comes to have HIV infection, then the blame goes on to her for spreading it to the family or their offsprings, so many things. So we need to definitely talk on about this gender inequality as well. Lack of comprehensive sex education, this is a very very important barrier when it comes not only to a state but to our entire country as well. We still do not have proper sex education that starts from the adolescent phase, when the adolescents are being introduced into this area of sexual activities and all these reproductive teachings. So in this community, which community will help us is the teaching community. That can definitely help in trying to talk about this more freely and also make the younger generation more aware of it. Poverty and economic instability, so yeah, this, as the name says for itself, poverty can play a big role, a big barrier, because of which they are not able to afford, or they are not able to pay for transportation, example, to come to the respective health center, and because of which it will lead to them carrying on with the disease. Lack of confidentiality and privacy. We do not usually, we are a very we are all social animals, definitely, yes. So when we hear a news, we tend to just talk about it, and then that talk just keeps going on and on and on. So imposing on the importance of this maintaining confidentiality and privacy when it comes to a disease like HIV, again, for the person, I think it's a very important thing. Inadequate support systems, many people are still, they do not have proper support, be it financially, be it from their families also. They might not have they might not have proper support systems, because of which again they are unable to even get themselves tested, and let alone get themselves treated. And lastly, migration and mobility. Living in a country like India that is so diverse, people keep keep migrating from one place to the other. So sometimes it's even difficult for them to continue a proper treatment from one place. So this again forms one of the barriers when it comes to community involvement. Next, please. So coming on to empowering the vulnerable population, so we saw the barriers that were there, that was stopping us as a community. What can be done? Some barriers we saw. Another one, if we are not able to deal with this barrier, maybe we will be able to empower the vulnerable populations. So like I said, the ones who are having high risk group when it comes to AIDS are female sex workers, men who have sex with men, injectable drug users, and transgender. For them, how do we empower these people, these population, so that they will be more inclusive in the society? So one of the first things that can be done is, uh, next please. So we can tailor interventions to specific needs. We can have a talk. We can go and talk to them personally. We can have a one-to-one talk and identify what are their specific vulnerabilities, and customize educational materials according to them. So, for example, what can I say in this is that most of the, maybe this population, that vulnerable population, I can say, maybe they are not even able to have the basic educational facilities that everybody has. So catering certain educational materials that are for them, maybe through pictures, or only through pictures, or maybe through videos, etc. Many new things, new advancements are coming in in this area. up. So customizing educational materials for them, that can be done. Secondly, we can promote inclusiveness and accessibility. Like I said, we can help them to access healthcare services. And second point, please. And we can also ensure access to information. We can make sure that they are also getting informed and they have a proper platform to get their information, and as well as get accessible healthcare services at any time possible. Then the third point, I think the slide is stuck at first. So can you move on to the third point, please? Yeah. This is the second point, that is promoting inclusivity and accessibility. And the third point is building trust and community engagement. Third point, please. So, in this, again, involving the community, it does not mean only the people who are there, like the general population, but one needs to also involve the community in Okay. So the fourth point, that is addressing the social determinants of health. So we saw that poverty is playing a major role in one of the barriers for community involvement, and especially with them as well. So helping different policy making to order to elevate the poverty in the particular community, and as well as education programs that caters to their needs can help in addressing the social determinants of health. And the next point, that is holistic health approach. So when we talk about the health, or when we talk about their particular population per se, we no need to only talk about one thing, like how they might be vulnerable to AIDS. We can talk about different things, maybe help them in their nutritional support, integrate mental health program as well. So maybe include the other, fields like psychologists and all these things, therapists, counselors, in order to have a more proper holistic approach, so that they will also have a reason to come and not be too different from the society. And the next point we have is monitoring and evaluation. This is very important. After doing so much, after trying to make sure that the community, that we have done our part in trying to make sure the community has got an awareness and being educated about themselves about this particular disease, what can we do in order to make sure that this continues, that it is not just a one time thing? We need to always make sure that we monitor and evaluate them. So we need to regularly assess the impact of whatever intervention that's being given, and we can use feedback from the community. Accordingly, we can adapt and also improve whatever interventions that we have given over time as well. So coming on to one of the last points, that is, what are the challenges and opportunities in the future? What are the challenges that we still have? First challenge that we were, before coming into this session itself, you all must have been aware, and I've been talking about it from the beginning, is stigma and discrimination. This will definitely be there for a long time, and in order to bring this down is going to be a long road, but again, it's not something that's impossible. So let us start with us to talk more freely about this subject, and also to talk more freely about all the other things that are determining about this disease in general. Second is limited access to healthcare. as we saw in the beginning of the slide, the last 95 target that was being given, that we are able to suppress a viral load. But how are we able to do that? If they get to healthcare properly, if they get to a proper healthcare facility. So, again, a big challenge for all of us is making sure that healthcare is accessible to all. Third is lack of education and awareness. Like I said, there we still have misconceptions and myths about how HIV is being transmitted. So improving and making having awareness programs, IEC sessions in about this disease and giving education and awareness of it will definitely make a very big difference. And this is one big challenge that we're still facing. Gender inequality, like I said, in one of the biggest barriers that we have, and resource constraints. Maybe there are not enough resources in order to help this population. So that again can be a challenge for us. But let us just not feel bad and stop at the challenges itself. There's so many opportunities that we have in order to come together as a community and help in dealing and combating this disease. That is number one, advancements in technology. We can see that technology is definitely improving so much as we go over the years, and using these advancements in technology will help us in creating more awareness, and that will in turn help us to come even more people to accept it and come together and deal with this. Global collaboration and partnerships, as a coming together as a community, we can also not just stay as ourselves, but also have global collaboration and partnerships, so that it cannot just be one thing, but help taking the resources, helping getting resources from others, and having this partnership will again definitely create more opportunities for getting to the community and using them as well. Community led research and data collection, again, if we let the people be a part of a research, or even collecting data per se, that itself will make a very big difference in their understanding, and also will be able to engage them as well. So that is another one very interesting opportunity that we have. Next is innovative educational approaches. So just like how we have advancements in technology, the way we educate, the way education is being given, can make a big difference. Not maybe the book and every the usual traditional approaches of having a book and paper and all these posters are well and good, definitely, but maybe we can be more creative and have more innovative educational approaches, so as to grab the attention of the community even more. Then empowerment through social media. Nowadays, most of our generation can't live without social media. We need social media. So why not use social media for an even better cause, to get more people aware about it, get more people to talk about it more freely, and hence they will themselves be, a channel of advocacy for this disease. And lastly, we have youth education and youth engagement and peer education. So engaging the youth and having peers educate them, just that is in a broad umbrella term, it is a youth engagement in general. So making a use of the passion of the youths and this understanding that they have, and their using their youthfulness, I must say, will definitely help us create more opportunities for this in the future. So, coming on to the conclusion of this, I would just like to conclude by saying that the information about HIV and AIDS to community will be a big dynamic and an evolving process. This is not just going to be done by in the next 1 or 2 years, but it's going to take a couple of years, but we need to start from somewhere. So definitely, with all the points that I had shared, I think we can all start from somewhere, maybe even start with us, with our family itself, which is a community. So engaging them, talking about it, and then from there going on to a broader aspect will definitely be a big evolving process when it comes to this disease, and partnership with people living with and affected by HIV is critical to sustainability and ultimate success of any HIV response. So when it comes to community aid, we have to make sure that we ourselves are able to go and reach out to those people who are living with HIV, try to be more inclusive of them, and so that they will be able to also share their experiences as well with the population, and then that will make a big difference in the understanding and awareness of this disease. So with this, I would like to conclude and thank you all so much for your patient listening, and I hope that this at least got some little bit new ideas, and it will hope each and every one of us to combat this disease. And the next time, whenever we have an HIV talk on HIV, the numbers would have decreased, and hopefully we'll see more community participation. Thank you so much.
It was a very insightful, actually, deliberation on a very important topic because in certain areas, always it is found that modern medicine support system works a lot, and this is one of the areas where probably the support system that begins from the family to the community up to that level is very very important. She is a very young person, and I was not actually probably expecting that such an insightful deliberation from her. It is so nice. And now I would like to request my colleague Dr. Madhusmita Borwa to deliver the vote of thanks formally to.
Thank you, Dr. Susibrata Goswami, ma'am. And today, the Center for Distance and Online Education has celebrated this World's AIDS Day. So, this on this occasions, this insightful, as Susibrata Goswami ma'am already told, that this lecture was insightful. So, on behalf of the Center of Distance and Online Educations, I would like to thank our resource person, Dr. Jongsina Zamir, and from the personal experience listening to you, I would like to thank you, in the sense that yes, the lecture was informative, and it is so systematic that from the beginning to the end, it was systematically the informations were systematically structured. In that case, like. Persons who are not that much aware of these, then definitely from your lectures got so many insights. And personally, I have to say that I didn't know that the AIDS is the last stage actually. So before that, it is the I think this information is new for me, and today it's just the new information that I think many of us are getting these informations. Not only this, like how you talk about the role of community. So that is the main theme of these celebrations for this year, and mostly among the all the community members, mostly how you have emphasized the gender. That is the most important and sensitive topic nowadays, because mostly we say that a particular gender is always blamed for certain things. So in that case, sensitizing that aspect was one of the important aspect for that I have found from your lecture. So I would like to thank you for this entire your effort for giving us the time and this insightful lecture as well. So I hope all the participants from I want to thank them also that they have participated here. And for the future, any kind of collaborations that our center would like to make with you, so I think in coming different events, our center will communicate with you regarding any other events that are coming. And yes, I would like to thank you on the behalf of the Center for Distance and Online Education, Tezpur University. Thank you.
Yeah, over to Akku.
That is the end of today's session. Thank you everyone for joining in. So we will be updating further more events. So do tune with us. Thank
Just
you.
to
Thank you.